welcome. Welcome to Diverse Conversations with Ashka Patel. And today I'm very excited to welcome our guest, Dr. Dave Dixon. Dr. Dixon is an associate professor and interim department chair at Virginia Commonwealth University School of Pharmacy in Richmond, Virginia. He is also co-director of the school's Center for Pharmacy Practice Innovation, which aims to be a leader in transforming ambulatory and community pharmacy practice and advancing pharmacist roles on patient-centered collaborative care teams. His clinical background is in cardiovascular, pharmacotherapy, and ambulatory care pharmacy practice. His research interests include team-based care for managing cardiovascular risk factors, hypertension, and dyslipidemia. Dr. Dixon is a fellow of the American College of Cardiology, the National Lipid Association, and the American College of Clinical Pharmacy. Thank you so much, Dr. Dixon, for joining us for this conversation today. It's a pleasure to have you, and I'm actually very excited to learn more about the incredible work that you're doing at the Center for Pharmacy Practice at VCU. Thank you again for making the time to join this conversation.
Sure, absolutely. It's pleasure's all mine.
Thank you very much. And I guess to get the conversation started, it's always a great inspiration when we hear of pharmacists who are doing such, non-traditional, but at the same time, such innovative, they're part of such innovative roles and settings. I would love to hear your story in terms of, how you started off from being a pharmacist to where you are now, and if you could shed some light on that, please.
Sure. So my interest in pharmacy actually started in high school. So I got a job at a local pharmacy. I knew I wanted to go into healthcare. I knew I didn't want to be a physician. I didn't like all of the blood and the guts and the details of all that. But definitely had a passion and interest for chemistry and biology. And so ended up getting a little pharmacy experience at a community pharmacy and going to pharmacy school at Campbell University College of Pharmacy and Health Sciences in North Carolina. And while I was there, really got interested in cardiovascular disease and the medications we use to treat cardiovascular disease, as well as diabetes. And I really wanted to, go in a slightly different direction than I had originally planned, which was to actually own my own pharmacy and to be in a role where I could work alongside other healthcare professionals, at the point of care to really kind of drive and inform best practices in terms of the use of medications to manage chronic disease. And that's when I learned about ambulatory care as an area of practice and a setting. I was very fortunate to do a PGY1 residency at the Asheville VA Medical Center in North Carolina. And after that, I spent 4 years at Wake Forest Baptist Medical Center. And that's really where I kind of learned the ropes of creating new services, implementing services to improve chronic disease. And based on my experience there and everything, I decided to make the leap into academia. And I've been at VCU what will be 10 years this January.
That's fantastic. Incredible. And again, as I said, I'm like, the inspiration is obviously there in your journey because, I think I was in a similar road where I was set, community pharmacy was my calling. And then, as you go through the years of being in practice, you realize that you want to explore other interests and, it leads you to new paths. And, I think I'm super excited to also learn a little bit more about, the VCU Center for Pharmacy Practice Innovation and, how does it assist in supporting initiatives and innovations in pharmacy practice?
Sure. So we recognized actually that we held a conference here in our state and brought in key stakeholders and really tried to learn what was going on in pharmacy practice in the state of Virginia, but also where did we need to go? And what grew out of those conversations was this idea of creating a center that would pull our faculty that were really interested in, dedicated to moving the profession forward. And so through the center, we have about 10 kind of external collaborative partners, including community pharmacies, as well as a couple different health systems in the area. And that allows us to work with partners to figure out what are their issues, like what are the struggles with trying to implement new services? What are your problems that you feel like there might be a pharmacist-based solution for? And then once we figure that out, it makes it a little bit easier to start to have conversations. We bring our expertise of research, clinical practice, but also experience in implementing new services in partnering with our external partners to help them establish new services, but also help to evaluate them and help to disseminate all of the great work that they're doing. So it's really a collaborative relationship. We really ask the partners to drive a lot of the things that we do. We also have our own ideas, and we'll reach out to our partners and see if there's interest. So it's a really great relationship.
Oh, that's fantastic. And I mean, so I am based in Toronto in Canada, and it's the whole Center for Pharmacy Innovation is still a fairly new idea for us, at least to my knowledge and understanding. And what I'm really hearing is that this is actually taking the process of innovation a little upstream, where you're now collaborating before actually implementing innovation, which I think speaks volumes to the need to have all stakeholders come to a common table and discuss the challenges before actually implementing those changes, because that can avoid a lot of hurdles we see down the road. And I think that kind of leads me to my next question. So as director of the Center for Pharmacy Innovation, and how do you describe the current pharmacy innovation landscape, and where do you see it going moving forward?
I think it's really exciting. I think there are a lot of great things going on in the community arena. I think one of the silver linings of the COVID-19 pandemic is, these opportunities, right, for pharmacists and to really shine in terms of providing access to vaccines, dealing with issues around misinformation about vaccines, and really that public health role that the community pharmacist has, I think, historically had is really, I think, going to be an emphasis moving forward, because I think at the federal and the state level, there's been increased recognition that, wow, these pharmacists can really help us with implementing our public health initiatives, not just related to COVID-19, but for other issues down the road. And I would also say that for the clinic-based pharmacists, there continues to be growing opportunities as drug therapy is really advancing beyond just small molecules that we take through a daily tablet or capsule. Monoclonal antibodies, small interfering RNA type medications. The therapeutics that we're using are changing rapidly, and I think that's going to create some increased demand for pharmacists to be involved in the decision making of what's an appropriate candidate for some of those medications, as well as ensuring the safe and effective use of those medications. So I'm excited. We definitely have challenges, but I'm excited for what the next 10 plus years looks like.
For sure. And you actually hit it right. Pharmacists are always been recognized as the medication experts, but I think moving forward, just the innovation we're having in drug delivery, also just like in the drug innovation space, I think we can truly pull that weight and be like, we are here to help you decide what's the best course to move forward, because I think moving forward, it's no longer just like, pharmacotherapy versus non-pharmacotherapy. We also are dealing with digital therapeutics and all of the other emerging, new emerging ways of how we're delivering medication. So true. And with that, I guess since we're talking of trends, what are some trends in pharmacy innovation to watch out for, or that hold a promise for the long run?
Yeah, so you kind of alluded to it a little bit in mentioning digital therapeutics. I think we're on the verge of a major revolution when it comes to what do we do with big data? What do we do with all of the data that our patients in the future are going to have? How do we collect that data? How do we get that data to the point of care so that it can be used to inform clinical decision making? I think that it really has the potential to transform healthcare down the road. High blood pressure, right? Managing high blood pressure really relies on blood pressure measurements outside of the clinic setting. We've known that, but now we really know that, and it's emphasized in our practice guidelines. And the days of our patients, bringing in the scraps of paper with the readings written down or trying to recall it from memory, I think those, issues can be solved by having robust remote patient monitoring programs and other types of digital health programs, where that data is being collected in real time, and then the team can actually evaluate that data and make therapeutic changes in between those face-to-face or in-person visits. Could some of this care be delivered virtually? I think we've been able to test the waters a little bit with COVID. I think we still have a little ways to go in terms of figuring out the best way to implement it. And some of our patients are still a little bit reluctant, and providers, and I'll say that even providers and pharmacists are reluctant to go down this road of the virtual visit and the digital kind of era that we're really already in. But I think that is really going to take off over the next 10 plus years.
Fantastic. And since we're talking of virtual care and remote monitoring, like, where do you see that fit in terms of the pharmacy innovation landscape?
Yeah, so I think for what I'm seeing and hearing, at least, especially with the large chain pharmacy groups that we have here in the United States, is a push for pharmacies to really evolve to become primary care homes. And so I could see that the pharmacy could serve as a hub for a community in terms of an access point for care, the remote patient monitoring. Where's all that data going? I think the pharmacy hubs, those primary care hubs, could potentially serve as a conduit for that data to flow through. And how we piece all this together is going to be the challenge. How do we make sure that information shared with all of the providers taking care of the patient, including the pharmacists? Yeah. Those are the kinds of things that we still have to work through. But I do think that there's an opportunity for pharmacies to play a role in that, that collection of data and even the utilization of that data to make therapeutic interventions as well.
For sure. And you had alluded to a little bit earlier in that, there are some challenges that we do face, when we're trying to innovate within the pharmacy space and even in healthcare space in general. From your own experience and your work so far, what can we do, or how can we promote innovation within our community? And, if there are any resources you would like to highlight for somebody who's kind of making a first go at it.
Yeah, so I don't think it's a mindset that most people who go into pharmacy necessarily have. Right?
Agreed.
Individuals go into pharmacy, and I can speak for probably, at least for myself, that, we tend to be rule followers. We tend to be a bit of a perfectionist. And with innovation, you have to be willing to fail, and you have to be willing to go, outside of the normal lanes. And realize that you may have to try 10 or 12 different innovations to find that one that's actually going to work. And so, I think it's that change in mindset. I definitely think that our professional organizations are beginning to recognize this. There are some resources available. Our annual meetings are starting to have more content around this area. And even outside of pharmacy, you can find online courses and even certificate programs now through a lot of different online programs, even universities. I know Harvard actually has a number of kind of business and entrepreneurial programs that are at least out there that I think, are types of things that practicing pharmacists might need to consider. And as far as our graduates and our current, PharmD programs, I think we really have to evaluate, how we're teaching these skills and how we can do a better job of helping students think this way, innovatively with an entrepreneurial spirit, helping them understand the business side of healthcare, as well as the policy side, because so much of pharmacy innovation, at the end of the day, it comes down to policy. And if we can't move the needle on the policy to, either change scope of practice laws or reimbursement regulations, then these innovations are going to have a hard time really becoming widespread and commonplace. And so I think those are some of the things that I think about and kind of the way that I look at this. But it's definitely something that takes some time to develop that skill and that way of thinking.
I agree with you completely on that one. And obviously, as you rightly said, I think when you are a healthcare provider, we do carry a very focused, laser focused perspective in terms of, what our career paths may look like. And we usually kind of shut off all the other possibilities until we hit those roadblocks in our career and our journey. And with that, I guess you must come across a lot of ideas and entrepreneurs and innovators who are looking to bring about change. What are some barriers or challenges, that are usually like the common theme that are usually encountered?
Yeah, so I think one of them would be having an idea that from maybe your perspective sounds great. So on the pharmacy end of things, it makes a lot of sense.
Yeah.
And then trying to move forward without thinking through and asking yourself, what other individuals might this impact? So obviously it's going to impact the physician or the advanced practice provider taking care of that patient. It's going to impact the patient. Does the patient want to do this? Do they want to go to the pharmacy to get their vaccines? Well, nowadays, that's not a big deal. But if we look back in time, that took a little time for patients to get used to that. And same thing with our medical providers. Whereas now, for even my own kids, my pediatric office just really pushes us, just go to the pharmacy and get it. Don't even bother with us. And that wasn't the way it was, 10 plus years ago. So that's one thing. So I think, making sure that whatever idea you have, that you think about who are the stakeholders, who is it going to impact, and bringing them in early to have some conversations can go a long way to preventing some issues down the road. But I think probably the biggest issue by far is how to make these innovations sustainable. In the United States, we've had quite a bit of advancement at the state level in terms of pharmacist scope of practice, prescribing privileges, but there really haven't been clear mechanisms in place necessarily to actually get reimbursed for the services being provided. And so I think for pharmacy, that's really the next big hurdle. And there's been some progress at the state levels, and that's really where that's kind of been the most effective approach, because at least here in the United States, ultimately we would need change at the federal level to really just open things up widely. And getting anything through Congress nowadays here in the United States is not necessarily easy to do. And so I think that that's another big factor. And maybe the last thing that the COVID pandemic especially has, I think, really brought to light is just the burnout and frustration that's occurring in different areas of pharmacy. If you're having such a hard time just managing the status quo, right? There's not that extra margin or space to start a new service or to be a site to test out a new innovation, because you're barely keeping your head above water. And so, those are just a handful of the things that I would put out there.
I agree. And I mean, you have addressed quite a few, and I think they're all relevant even to the Canadian landscape, as we share,
Sure.
the same challenges even on the Canadian side of the border. And, reimbursement, I think, continues to be a challenge. And I think moving forward, after post-pandemic, I feel like that is going to be one of the biggest hurdles that we may need to think of, especially with the budget deficits and everything else. When you have a government who's providing reimbursement for your services, you have to be mindful of how resource allocation is going to take place post-pandemic. Those are some great insights, and thank you so much for sharing those, because it gives me a little bit of, reassurance to know that we are not the only ones, but at the same time, it also makes me question, how can we overcome these challenges together? And, it's one of the themes that I'm trying to explore through such conversations is, what does a collaboration look like for both Canada and US to move forward and advocating our profession and creating that harmonized scope and hopefully branding for pharmacy that kind of allows us to leverage that brand to further promote what we have to offer to our patients, right? With that said, how does a current practicing pharmacist, you had alluded to this a little earlier, where burnout is significant. If a pharmacist is wanting to make a switch and become a startup or an innovator or start a startup, how do they go about it? Any tips that you could provide to our audience for that?
Yeah, that's a great question. And, I would say that where the need is, I would say we're a little behind in terms of having the right resources. We've had some conversations here about potentially, creating some kind of program or certificate. There's been a big kind of increase in interest or growth, I should say, in online, what we call digital badges in different areas. And that's now becoming it's becoming a recognized commodity, especially in the technology and health innovation space. Google and other companies, they're pretty much training folks themselves, right?
Yes.
And so I think that there's maybe an opportunity there to think about that, realizing that our colleges and schools of pharmacy may not necessarily be able to provide all of that, especially for practicing pharmacists who are already out there who are looking to make the change. That's the group that I think we have a ways to go in terms of helping those individuals make pivots and transitions in their careers, because right now it is very just kind of organic. It's the connections you might have, and it's, well, I could go get an MBA. Well, that's going to be expensive and it's going to take time. And if you're already stressed and burnt out, that may not solve that problem. If you've got a family, that's going to be difficult. So the kind of old way of thinking about, I got to go get a degree, I think that to some degree might be replaced in the future with some of these ideas around digital badges or certificates and other kinds of programs. So there are definitely digital health technology related startups out there that are realizing the value of adding a pharmacist, especially if their company is dealing with medication related issues. They've got all the technology knowledge in the world, but if they don't understand how pharmacy practice in the healthcare system works, they're going to have a hard time with implementation. So I do know colleagues. I have colleagues that they pivoted. They're working with startups. They're involved in some of these kinds of opportunities, and it's going to be exciting to watch. I think there are more opportunities than people probably are aware of. But I would agree that we definitely need more resources and need to think strategically about how to help folks make that transition.
Fantastic. And I guess with that, since we're talking of choosing career paths and navigating change, what are some new and emerging roles you see being created for pharmacists, especially pharmacists in the next 5 to 10 years?
Yeah, so as I mentioned, I think the startups, that are going to be looking for individuals to provide that clinical expertise or potentially even run a clinical team that kind of helps, manage that part of their innovation.
Right.
Certainly is important. The public health role is, I think, something that really has a lot of potential, and I think that pharmacist involvement with local health departments at the state level and even federal level, I think those opportunities are going to increase. We've always had opportunities for pharmacists to work, with either the FDA or the CDC, but I think at a more local level, increased recognition of the important role of pharmacists in emergency preparedness, public health, vaccine access and administration, is really going to create some opportunities, I feel like, in the coming years. And then with the specialty practices, specialty areas clinically, that medication regimens are not getting less complex. And I can certainly see where, there's been some controversy and disagreements in the past about how specialized should the profession of pharmacy be. But I think we're at a point where we kind of need to be. I think it's very difficult to be a generalist practitioner. And especially if you look, 10 years plus down the road, these areas such as oncology, even cardiology now is getting super complex.
Exactly.
It's really going to require a different skill set than what can just be provided in a doctor of pharmacy curriculum.
I agree. And it's kind of similar to, how we had seen the hospital pharmacist role become specialized in different niches depending on, what their area focus was. And I feel like that would be kind of like the model that you would need to kind of replicate to the community side and just a profession in general. And I mean, I really admire the way American pharmacy, like the college, has different certifications available for different specialties, which is something we need to work on a little bit here in Canada because we do not have that distinction quite yet. But I agree, I do feel like the roles of pharmacists would become fairly specialized depending on where you choose to practice. With that said, how do you describe the future of pharmacy in the next 5 to 10 years?
I think it's going to look much different. I think in terms of community practice, I can see certainly the role of the pharmacy technician changing. If pharmacists are going to carry the responsibility of potentially prescribing, doing rapid influenza tests and potentially treating those patients or urinary tract infections, those kinds of primary care related things, we're going to need to hand off some of those dispensing duties to pharmacy technicians and give them some greater responsibility. That's not going to be easy because we're going to also have to improve the training that they receive, and that's going to come with higher pay, right? It's not going to be fair to pay them what they're currently making and expect this higher kind of function. So that's going to be some growing pains that I think we're going to experience in the coming years as that transition kind of takes place. And in terms of clinical practice and kind of the clinic setting, I think we'll still continue to see growth in the ambulatory care space. I think specialist providers in particular are really, getting accustomed to being trained in working with pharmacists. They're accustomed to having that resource. And I can think of some other physician colleagues that have changed institutions, and they've gone in and they've gone and say, yeah, I'm happy to come start this program here, but you're going to have to make sure I've got a clinical pharmacist with me.
Wow, that's fantastic.
That to me tells us that we're really starting to get to a place of where, looking down the road, that the presence of a pharmacist in a clinic will not be unusual, because as much as we all recognize colleagues in places that have pharmacists in the clinic setting, that is by no means the norm in most institutions, particularly outside of academic medical centers, outside of the VA healthcare system, or some of our other kind of managed care systems, at least here in the United States. So I'd really like to see that be the norm. I'd really like to encounter patients who are not surprised that their visits with a clinical pharmacist, that they're like, oh, okay, that it's not a surprise to them. That to me would be a great goal. And that just brings me to bring up another issue that we have to address, and that's just increasing public awareness and knowledge of what pharmacists do. And it's not that there's no one's ashamed of the past and the history of the profession of pharmacy. We're a diverse profession, but fundamentally all very much the same, very much focused on improving medication outcomes for patients. But at the same time, there are different roles, and we've got to work harder to make sure the public is aware of that.
I agree. I mean, we need to definitely make sure that the image that's kind of ingrained and inherently that first image that comes up is a pharmacist counting pills, right? Anytime a mention of pharmacist is being made. And I agree with you, we need to change that narrative, not necessarily because we are embarrassed by it, but more so because we do offer so much more now, and moving forward, we're going to offer more and more clinical services to our patients. And to wrap up our conversation, because this has been fantastic, you've shared some great insights in terms of, innovation and, how do we navigate it? Because I think it's always great to hear leaders who are trying to, make that change for us, who are on the front lines, may not necessarily have all this information to truly understand and appreciate the work that goes in the background. So I thank you for that. And to wrap up the conversation, one advice for pharmacists as we prepare for the future?
Yeah, so flex those creative and innovative muscles. There are, I think, again, it's a mindset, it's a change in how we think about things. I think it's where getting outside of the pharmacy bubble, talking to other healthcare professionals, talking to our patients, kind of understanding what the needs are, and being willing and brave enough to come up with some solutions. We have many problems in healthcare. New drug therapies, that's not going to solve all of our issues, right? Because we have new drug therapies all the time, and we still see that it takes 17 to plus years for practice guidelines to be fully implemented into clinical practice. And we have issues around access to care. We have issues around disparities in care, inequity, which has certainly been even more highlighted because of the pandemic. And I think pharmacy has a real opportunity to lead in some of these efforts, but it's going to require us to step up into some roles that maybe traditionally we've not been comfortable being in.
Right.
And realizing that it is going to take major contributions from everyone, not just to move the profession forward, but to solve all these, major issues that we have in healthcare and those to come that we don't know about yet.
For sure, for sure. And with that said, I think I always am being mindful of the current students who will soon be joining our profession in the very near future. And I know you work very closely with them through your work. One advice for our current students and graduates who are about to enter the profession?
I would say be very open-minded in terms of the opportunities that you're going to consider after you graduate. I think traditionally, and most students come into a PharmD program and they think of community practice, they think of hospital pharmacy, maybe industry, maybe pharmaceutical companies, there's some knowledge and awareness that that's an option.
Right.
But we have a lot of work to do to make our students more aware of the opportunities and to encourage them to pursue those. So that means helping them understand, what those opportunities are, what skills they're going to need. And, to students, I would say, if you have an interest in technology and digital health, great. You can take that PharmD and that interest and really do some really cool stuff. And entrepreneurship, business, all of that, I think is going to be great. And I think a lot of our PharmD programs should certainly look at recruiting future students, beyond just the hardcore sciences, because those individuals with that interest and skill set in business, technology, may really create some interesting opportunities down the road. So yeah, be open-minded, think beyond kind of traditional pharmacy roles. Don't be afraid to reach out and ask for advice. Social media makes our world much smaller. I did a talk yesterday for some of our students on using Twitter and professional networking. The worst that someone can say is no or not respond at all. And so don't hesitate to reach out. And if you see someone out there with a career that you would like to emulate or that you'd really admire, reach out to them. It's something that I think students don't do enough. So
I agree. And I mean, to be honest, like that's how we connected was through LinkedIn. And, I thank you for, taking up, giving me this opportunity to have this conversation with you, because
sure.
Trust me, it has been, your insights have been incredible. And I think, the perspective you bring to this conversation is very unique in the sense that you are at the forefront of innovation, where you're trying to work with all these stakeholders to navigate change and bring in that much needed innovation, but at the same time, balancing the scales, right? And it's never easy to do that work. But thank you so much for sharing those insights, because I think I learned a lot from this conversation for sure. And I'm certain that the audience will be listening in will also learn just as much, if not more. And I'm sure, they can always reach out to you should they have any questions. I'm definitely happy to link your information with this video so that they would have that. Thank you so much, Dave. This was a great conversation. It was a pleasure having you. And thank you so much for sharing those incredible insights with us today.
Absolutely. Thank you very much for the opportunity. It was a lot of fun.
Thank you. All right. With that, we're going to end this episode right here. Be sure to tune in for our next episode next week. Thanks. Bye.